Dr. Jessica Burke from the University of Pittsburgh.
Hi, and thank you all for coming today. When the Pittsburgh AIDS Task Force approached us and wanted to do a needs assessment, I was eager to collaborate, identifying areas of need as well as assets within a community, and then developing appropriate programs is sort of the cornerstone of what we do within the Department of Behavioral and Community Health Sciences at the Graduate School of Public Health. So, as people live longer with HIV/AIDS, multiple challenges emerge, and we need to evaluate whether existing services such as housing, employment, mental health services, substance abuse treatment, whether or not they're actually meeting the needs of those individuals. The goal of the Southwestern Pennsylvania HIV needs assessment was to determine how to better support the needs of people living with HIV in our region. And from the very beginning, it was a very collaborative process. We've developed a great relationship with the Pittsburgh AIDS Task Force, and in particular, Kathy Boyle. And what we did was work together to really develop the program or the project in terms of the recruitment methods as well as the survey instrument and the interview tools. So what we did for the project was review published studies and then use two primary data collection methods. We interviewed 320 individuals, HIV positive individuals, using a survey, and then also conducted in-depth interviews with 5 HIV positive people. We used a creative process of recruiting the 320 individuals. In addition, and Kathy mentioned some of this already, but in addition to the more traditional posting of flyers and informational cards, we had an online posting with a banner that allowed you to click on it and then go directly to a survey that was available online. We also distributed the materials, the recruitment materials at appropriate venues, such as this summer's Pride Festival, in an effort to really get people to participate who may not be in direct care right now. So sort of to the meat of what we learned, people that we surveyed told us that living with HIV/AIDS in Southwestern PA really presented multiple challenges and areas of unmet need. They underscored the difficulties that they face in living with HIV. Only 1 out of 3 said that their general health was good. 24 people, or 8% of the total sample, reported that they didn't have a current medical provider. And many basic health and social service needs are not being met. So as part of the survey, we provided a list of 14 community-based services and asked if there were any services on the list that they needed but could not get. And close to 20%, or that's really 1 out of 5 of the respondents, said that their dental care and transportation needs were not being met. So I'll now turn it over to Dr. Fryer, who's going to present information about the barriers to care that were identified in this survey.
So I've been working in HIV prevention among minority and other disadvantaged populations for about 12 years now. And I've left the city of Pittsburgh to do my doctoral work, and Pitt came calling, and now I'm back. So I was actually very excited once we got the call from PATF to conduct a needs assessment, because it gave me an opportunity to then work again with PATF. Many, many years ago, I used to volunteer for some of their initiatives. Unfortunately, we still live in a world where there is stigma of being HIV positive, and it creates problems for individuals when they are trying to seek care. Dr. Burke just mentioned dental care is one of the major needs that many of the respondents identified through the needs assessment. What I would like to do now is to share a quote with you that came from one of our male respondents. So this is an individual who in phase 2 of the needs assessment called in and was conducted a qualitative interview over the phone. And this is one of the points that he shared as it related to dental health problems and his troubles finding a provider. Quote, "Side effects to take medications that you have to deal with. One of them is having dental problems. It is so hard to find a dentist that would accept me. I have been told not to just tell them that I'm not HIV positive. I want them to know, because then they can treat me knowing the symptoms. I want to be honest. Finding a dentist that treats HIV positive persons is very hard. Either they don't accept your insurance or their quota for that month has been filled. I really want to go see a dentist, but I get the runaround. Again, I believe that here in the Southwest region, particularly Pittsburgh, there are great resources. But as Dr. Hunt alluded to, if they don't know about those resources, or if people do not feel that they are welcome to embrace or to engage in those resources, then we have information like this that came from our needs assessment. As part of the survey, we used an established measure called the Barriers to Care Scale. And it was to assess what extent certain circumstances made it difficult for people to receive the care that they wish to obtain. 29% of the study participants stated that the community stigma against people living with HIV and AIDS made it difficult to seek care. Nearly a quarter reported that the community's lack of knowledge about HIV/AIDS also made it difficult to seek care. Additionally, I want to highlight that more than a quarter of our respondents surveyed reported that they experienced what is called AIDS-related discrimination by a provider at some point during their illness. We don't know if that was a current time or it could have been a past time. So what do we mean by AIDS-related discrimination? As the scale is used, a number of respondents reported that a provider had been uncomfortable with them, that they had treated them as inferior, that they had preferred to avoid them, or that they had refused them service. Of the 29 people who reported that they had been refused care by a provider since they had had HIV, over half, or 55% of them, reported that that was a medical provider who refused them that service. Those who reported AIDS-related discrimination indicated it was related to their needs for dental care and for alternative therapy. More importantly, which has already been established, we know that there are special populations that need direct attention. We clearly know that African Americans are disproportionately affected, particularly women and youth, as well as individuals who are living below the poverty line. And the needs assessment also highlighted special needs for those individuals that are living in rural populations. Close to 1 in 5 rural respondents reported unmet dental care needs as well as housing needs. If you look at the total sample, 320 people, while only 12% of that total sample reported that long distance to medical facilities and personnel was a barrier to seeking care, close to 1/3, or 33% of rural respondents stated that this was a problem. In addition, that rural subsample, 35% of them, as compared to 29% of the total sample, felt that community resident stigma against persons with HIV was a barrier to care. We are clearly standing here today recognizing that the advancements in treatment have really changed the way in which we look at HIV and AIDS. The needs assessment was really done just to see where we need to go from here. Are there continued unmet needs that we are not in any way addressing? And I submit to you, based on the needs assessment, that living with HIV and AIDS presents major challenges to some residents of Southwestern Pennsylvania, and we need to find more effective ways to address their unmet needs.